Thank you, my friends, for joining me today. I'm here to give you an update of my understanding at this point about the whole COVID virus pandemic, the ways that the world, the powers that be, are telling us that we need to respond to it. And the scientist whose work has made so much sense to me and explains how our standard of care recommendations, well, to be direct, are crazy. They make no sense. They only make us sicker. And I'd like to share with you profound science of brilliant scientists and virologists and medical doctors who have been treating people and what their findings show. And if you look, you will find that not only am I sharing some YouTubes with you that agree with these things and give you scientific information as to why you should consider these ideas, but you will find from your deeper understanding of what you might learn if you go to the YouTubes that I'm going to direct you to, that you can find many YouTubes on your own that will corroborate the findings of these brilliant scientists who actually are even putting themselves in harm's way to share this information with you. So the first thing I want to share with you is that the reason why I'm doing this again is because it is so hard for me to see my patients walking in the door totally in fear, anxiety, depression, confusion, upset, thinking that because of their age or because of something that they have to not share with their loved ones, to not do the things that they enjoy so much, and to live in a mask, and to live in a very isolated world. And the big thing is they are living in fear. And I know I've said this before, but to me, the biggest pandemic is the pandemic of fear, and our stopping to really question what makes sense. So we are going to question what we have been told we have to do, and if it really makes sense, and if it has indeed proved successful in the results that people are looking for, or if other countries have proved themselves successful doing other things than what we are doing in the US. I'm going to send you to a number of doctors' work and websites and specific YouTubes that I think will help you to get a deeper understanding of this. Some of them are quite complex, and I'm going to attempt to give you a basic, simple understanding of the primary takeaway that I received from listening to these YouTubes. This by no means means that you should not watch the entirety of these YouTubes, because you will find extraordinary information in them. And even just listening to the parts that make no sense to you if you don't have a strong chemistry background or understanding of our biology, just let those parts go through and listen further on, because you will find that at the heart of each of these men is an incredible humanitarian plea. And they will, in simple terms at some point, explain why it is so important for you to go into your own heart and question if we want to follow the wisdom of nature and science that's based on nature, or if we just want to base science that's based on genetics or science that's based on chemistry and has no connection with our ultimate personal, internal ecology and how we are truly ecological beings, like our soil, like our earth, like all of the beings on this planet. And how together, if we begin to understand these principles, we realize that our body is not our enemy. that what we're calling viruses is not an enemy. That what we are calling sensible, like wearing masks, may not be. So let's start first with the person that I introduced you to way back in the beginning when all this first began, and that was Dr. Tom Cowan. Tom is a medical doctor and has a background in anthroposophic medicine. He's steeped in a very deep understanding of who we are, not only as physical beings, but as energetic beings as well. And if you go to his website, drtomcowan.com, you will find there that he talks to you about this spiritual science of Rudolf Steiner and how it dovetails with our current science that includes things like our updated equipment, our microscopes, atomic microscopes, our genetic information, and how some of this information may be misleading, and how we've taken really sensible science that has been around forever, called the Koch, K-O-C-H, postulates, that was for many, many years used as a way to prove the transmission of bacteria and infections, but has no way ever been able to prove the transmission of viruses. And when that happened, scientists decided to change the rules and make them so that we could identify something as a harmful living thing, which is not true. A virus is not a living bit of matter like bacteria or fungus, but is a package of information that has DNA and RNA information that is here to help our bodies to transform and to be able to deal with the new challenges that we are presenting it with poisons. And here we go to the work of Dr. Andrew Kaufman, who goes into great depth with lots of visual support to help us to understand something quite complicated, the Koch postulates. But to simplify it, what I want to tell you is, in the past, if you were to have a strep throat, and many of you probably remember this, someone would put a swab in your throat, and they would be able to take that infection from your strep throat and grow it out on a Petri dish. And then they could take that infection and they could give an injection of that to another animal like a mouse, and it would get strep throat 100% of the time. That's part of Koch postulates. That if we're going to call something a transmissible disease, something that you can give to another, it needs to be transmissible 100% of the time, not just 20% of the time or 40% of the time. How many times have you and I been in a room where there's all of these children who are sick, and some of them get it and others do not? That is the difference between being able to call something an actual transmissible disease or not. And we have changed the rules so that medical pharmaceuticals, I believe, can create new vaccines and new medications for something that is not a transmissible disease, particularly vaccines. The next thing I want to share with you, because it's been a deep concern to many of my clients and deep concern to me because of my personal experience, is the whole idea of wearing masks. And here I'm going to step up and possibly get myself in trouble, but I'm going to tell you that every time I wear a mask, I feel irritable, I feel miserable, I feel tired, I feel awful. And I now have some understanding as to why that is. So many of you know of an organization called OSHA. And OSHA sets standards that has to do with environments that are healthy for children to go to school in and for people to work in. And one of the standards that they set has to do with CO2. And there is a person named Bigtree, and we have his information on his YouTube here, where he's doing a very basic, simple test with, I believe, OSHA recognized equipment to test the CO2 levels that happen to us when we are wearing a mask. A mask prevents us from breathing oxygen through our mouth and through our nose. But it also, more than preventing us from breathing oxygen, it keeps the CO2 that we breathe out in close proximity to our noses and mouths where we breathe it in. OSHA says that there are particular numbers that are toxic and harmful to the human being. And what Dell does is he takes his healthy young son and uses a mask and shows that within half a minute his son is already at toxic levels of CO2, just being a normal kid, doing nothing special, just sitting there being tested. And within a minute, his toxic levels of CO2 are twice the normal amount. And within a couple minutes, it's beyond the level of even measuring it is so toxic. Clearly, OSHA would shut down any business that had CO2 levels at the numbers that this young child was breathing just with a mask on. Then they do the same test with just a bandana. Now, there have been some YouTubes. I'm not sure if their purpose was to try and show that this testing was not important, but they used a little device that we use in our office a lot. It goes on your finger and it tests your blood oxygen concentration levels at your extremities. And the thing that I want you to understand is that CO2 itself has its own toxic events. There was a movie about the Apollo 13 based on truth that showed that the big problem that happened to the astronauts was they still had normal oxygen levels in their during their trip, but the CO2 levels became very high because the equipment that was designed to purify the CO2 stopped working. And the causes of the people's movement into first high blood pressure, emotional distress, psychotic behavior, and eventual death was not that they didn't have enough oxygen, but because these people had exposure to toxic levels of CO2. The issue is not the oxygen saturation levels. The issue is how high did those CO2 levels go? Especially for the elderly who are in great fear and are wearing these masks because they are in fear and afraid that if they don't wear them, that they're going to receive a deadly virus that's going to kill them. Now, I personally think that what we're doing instead is we are reducing our physical capacity to deal with toxins by wearing a mask. We are poisoning ourselves with CO2. And then the next thing is that scientists know, virologists know, that a mask will not stop a virus. When they're doing intense work with deadly viruses, which they're calling it, but they really know they're exosomes, not viruses. When they're doing work with these sorts of things, they wear hazmat suits with glass protective coating in front of their faces and noses, and they have their own oxygen systems and abilities to break down the CO2 that they're breathing out into the hazmat suit so that they're not breathing those high CO2 levels. That is not wearing a mask to prevent yourself from virus. In fact, we know that they are so tiny that there's no way that a mask would stop them. And one of the other concerns about wearing a mask is that we also know that there is a degree of humidity that we breathe out whenever we're breathing, and we're breathing that humidity into a mask, which makes that environment inside the mask and on the outside of the mask a perfect breeding ground for other bacterias, for other toxic things, and for mold. So that you are literally creating a challenge to your body's immune system by wearing something that cannot possibly stop something as tiny as an exosome/virus. And I would like you to look at the YouTube that's done by Dr. Richard Bartlett, who is a very straight-laced medical doctor. The other doctors I've talked to you about could be considered to be alternative medical doctors with a straight-laced medical training who went beyond their straight-laced medical training into exploring other arenas, but not Dr. Richard Bartlett. He appears, at least to me, to be a very conventional medical doctor, a devout Christian, and somebody who has been part of special committees for the senators here in Texas, exploring the special needs of rural people who are not getting the kind of medical care that they've needed, and looking to him for recommendations. And when he was in the hospital dealing with people who were horribly ill with COVID, he sat down to pray, fell asleep, and he came up with an idea that he decided to check because it wasn't outside of anything normal. He decided to check the possibility of using a steroid that had been used for over 25 years for babies and children and adults who had asthma. And he administered this particular steroid called budesonide with a special device called a nebulizer. He found that with most of his patients, one treatment and all of their unusual symptoms were gone. Now, when I say unusual symptoms, what I'm talking about is a set of symptoms where a person will appear blue, where they cannot breathe. And typically what happens within a short period of time is that there's blood coagulation that takes place, and it clogs up the tiny little vessels that go into the lungs, but into other tissues of the body as well. And we see that the organs shut down and people die very quickly once that happens. What Dr. Bartlett found is that with every person he treated, within 1 to 5 treatments, they were completely well. Even people, his own patients, who were of the highest risk of anyone. In particular, he tells of a woman with 2 forms of cancer who he did just 1 treatment with. And she was breathing, she could sleep, she went from blue to normal color and literally went to work the following day. She wasn't cured of cancer, she just no longer had a fever and an infection and this particular problem. He also shares with us how in other countries where people are pretty much on top of each other, where like in Taiwan, where there are 26 million people who had COVID virus and were admitted to hospitals, who were given this treatment, only 7 people died. 100% of the people seem to be getting well who are receiving this treatment with steroids through a nebulizer. Why not try it here in the United States? And one of his biggest concerns is that the NIH has said that they're willing to try it, but not until after people have been treated with something that has clearly weakened their immune system, being administered in hospitals today. And so what I encourage you to do is to look at Dr. Bartlett's YouTube. It's very compelling. And he's saying, let's use this as a first line of defense treatment. This medication is readily available. And for many people, their insurance will pay for it. It's a highly tested, non-toxic form of treatment if it's only given a few times. Now, personally, you all know that my interest is in alternative medical types of treatments. I would much rather see you do an ultraviolet light blood transfusion. And many alternative doctors are using ultraviolet blood irradiation as a treatment for many different issues that involve infectious disease. There's like over 100 years of history from Johns Hopkins Hospital and other clinics where this has completely rid anybody of everything from polio in one treatment to pneumonia to any bacterial, fungal, or viral infection. I think you have heard me talk about how I have used homeopathic remedies, and within less than a week people were completely well and were greatly relieved of their symptoms within 24 hours. There are other options besides what we are being told. There are frequency devices and work with Rife equipment and work with color, light, and sound that have proved very effective. But today, what I'm trying to do more than encourage you to work with the things that I personally find are very valuable, but to encourage you to consider some of these more medical-focused suggestions. And the bottom line is to just overall support you in being a healthier human being and increasing your own mitochondrial function and your own ability to adapt to changes, to use exosomes in a very supportive way and viruses in a very supportive way, to upregulate our own body's capacity to deal with more and more poisons until we gain the wisdom to stop increasing the amount of poisons that we're introducing to the earth. And so that brings me to the next brilliant doctor, and that is Dr. Zach Bush. And in a YouTube that I'm recommending here, he is being asked 5 very poignant, direct questions about what is a virus, first of all, and secondarily, what can we do about COVID, and who are the people who are most likely to die from COVID, and what we can do about that. And what are the contributing factors? One of the things that Dr. Cowan talks a lot about is how our sensitive electromagnetic field and the influence from 5G. And what Dr. Zach Bush is bringing up, because it's one of his primary areas of research, is glyphosates. And also about respiratory particles, molecular particles of a specific weight, in this situation 2.5 microns, and how breathing those in will create a problem with our natural body's defense mechanisms. And I'm going to let him explain it to you. But that level of micron literally stops our protective genes, which would typically chop up what we're calling a virus or an exosome that's more than we can deal with, so that it doesn't harm us. But those people who have exposure to the glyphosate and who also are taking some specific medications that interact with these 2.5 micron particles are dealing with a situation that's beyond what they can, especially if they're just being treated with respirators and antibiotics, and they are dying at 88% in ICU, instead of having the numbers that we're seeing in Taiwan or Japan or Iceland. And there are other countries who are doing studies about these other forms of treatment. Well, what Dr. Zach Bush is pointing out is that this exposure to toxic air is, with those 2.5 micron particles, is particularly challenging for people who have cardiovascular disease, diabetes, and late-stage kidney disease, because they are being medicated with ACE inhibitors and substances like Lipitor that reduce cholesterol. And those interactions with these microns have created these large particles that the genetics of our body cannot break down, which leads to coagulation, so that the oxygen cannot get into the tiny vessels in our lungs first, but then into our organs, and we're seeing people turning blue, not being able to breathe, and then we're seeing their primary organs shutting down because the oxygen cannot get through the blood into those organs. And the thing that matches that exactly, a toxin that is a 2.5 micron, is cyanide. And there are numerous different substances that are in pollution that have similar 2.5 micron sizes, like the exosomes from glyphosates. And we are seeing this horrible situation happening to people. And so he has found that working with a cyanide poison pack, which includes 3 injections, and it costs $10, has been his answer to how to deal with this problem. From the very beginning, we have seen medical doctors in hospitals saying this is an unusual process that we're seeing, that we're calling COVID. It's not reacting or responding like typical respiratory viruses that we've known in the past. But Dr. Bush is pointing out that there are some coronaviruses that we have seen in the past that have actually caused this kind of lack of oxygen that creates this problem where people turn blue, their blood coagulates, and we then have organ death. And so he is looking at the similarities between these SARS viruses and basically saying we need to consider different things that will help to thin our blood. And his answer is to consider using the cyanide packs. And I've been encouraging people to make part of their personal program eating foods like garlic, like turmeric, like taking vitamin E, and a Japanese food called natto, or taking a supplement called nattokinase that naturally helps to thin the blood if you don't have a problem with having too thin of blood already. And then, of course, there are homeopathics to help you with whatever symptoms should show up. The last person that I want to really encourage you to look at more deeply is Sacha Stone. And what Sacha is doing is he is calling us back to our humanity. Actually, each of these doctors are. Dr. Thomas Cowan has made some very, very powerful pleas for us to look at our humanity and look at what we can do to support each other in these times. And isolating is not the answer. Not being at the deathbeds of our families is not the answer. Basically, not receiving oxygen and sharing our CO2 with nature is not the answer. I can't tell you how upsetting it is to me to live on a beautiful natural park and to see people walking at great distance from each other with masks on, or even to see someone in my neighborhood who might be the only person on the street walking with a mask on, when they could be receiving healing oxygen and sharing their CO2 with the plants that need it, and having an exchange of energy that's not based on fear of infection and virus, but that's based on an understanding that our bodies are here to help us. They're not stupid. They're wise. And if we can start honoring our nature, the natural goodness of the wisdom of our own bodies, and start to look into medicines that honor the wisdom of what our bodies are doing, and looking at how we can support our body's processes instead of negate them, which always has a backlash. every medication is pretty much a poison and has a equal and opposite effect. So what we're calling pharmaceutical medications always come with a price. But that's not necessarily so when we're looking at things like positive thought and love and eating healthy foods and breathing good air and getting out into awe-inspiring early sunrises and being outdoors for sunsets and walking barefoot and exposing ourselves to the beautiful energy of nature in walking in our forests and in our parks and in, by the lakes and by the oceans. That's where the healing comes from. And the healing comes from sharing kindness and compassion and love with each other. And so that's what I'm encouraging you to do. My work, when it comes to what I do as a naturopath and a homeopath, all has to do with restoring your body to its natural gifts, to its natural healing capacities, be it through frequency and homeopathy, be it through substances that come from the earth, like really highly understood fulvics, and blending those with specific herbs and minerals that are plant-based in nature, things that we have brilliant scientists now that I talk about in my other YouTubes, and the work that I'm doing to help support my patients who have been chronically ill for a long period of time, or just people who want to be at the top of their game. So I encourage you to look further. I encourage you to find answers that bring you peace, that bring you love and not fear. And explore the work of these brilliant men and see if you might agree with me, and see if you might feel that these people's work might be acceptable to your family members. And I thank you so very much for your time and consideration. We'd love to hear from you about what you think about this YouTube.